Hi, everybody. Welcome to Resolve's Kitchen Table Conversation Series. It's a new digital series hosted by Resolve, the National Infertility Association, which brings back the nostalgia of our founding around Barbara Eck's kitchen table. Ms. Eck founded the first Resolve support group in 1974, where she brought women together to discuss issues that mattered to them. We are proud to carry on this tradition through our nationwide network of support groups that also include men, not just women, and through this new web series where we tackle important topics to anyone who is challenged in building a family. Today's kitchen table conversation is men and infertility. I want to clarify that this is not a medical discussion about male factor infertility, that's when the male partner is the medical reason for the infertility, but how men fit into the family building and infertility experience and the conversations around them. Let's get started to meet these amazing groups of guys. Gentlemen. So I'm going to start with Ryan, and I want the audience to get to know each of you a little bit more. So I would love for you to share your name, a little bit about your personal infertility journey, why you decided to talk openly about it. And again, I want to start with you, Ryan, because I also want to make sure you talk a little bit about what you did last week with Resolve.
Sure. So thanks, Rebecca. My name is Ryan Ferrante. I'm a Midwest guy. I'm professional in Chicago. I'm an assisted reproduction attorney, but I came to that through my own personal journey with my wife through infertility. We got married in 2013. We wanted to have a family. We tried the ways that we knew how to explore options for those that were struggling with natural reproduction. We met with a reproductive endocrinologist, and then another, and then another, and then another. We ultimately had success through IVF and through surrogacy. We have 2 children, a 3.5-year-old son and a 12-week-old daughter, carried by the same woman in Tallahassee, Florida, who I know that there's not enough time on this in this meeting for me to talk about what she means to our family, but I can't have one of these conversations without mentioning the fact that she's become part of our family. She really has. And so I was practicing law at the time, and I was trying to absorb as much information as I possibly could about our own experience to help us. And that led me to a career in assisted reproductive technology law, where I now represent surrogates and intended parents and donors in collaborative reproduction arrangements. And so I am an intended parent. I'm a former intended parent. I suppose I'm always going to be an intended parent because that experience was such an important part of my life. But I'm also an assisted reproduction attorney. So my day consists of continuing to have those conversations every single day. You mentioned last week, as part of our experience, my wife and I turned to many organizations to help us try and understand what this meant for us as we tried to become parents. And the Resolve was irreplaceable. They provided us with information and held our hands and lifted us up when we really didn't know where else to turn. And so we've given back to Resolve in any ways that we possibly can, including through Resolve's Federal Advocacy Day, where myself and last week over 500 people met virtually with their members of Congress to talk to them about legislation that can improve access to infertility coverage, which, at the state level, we have made some inroads, but at the federal level, we certainly could be doing a lot more. And so last week we had those 500 people getting together virtually, and we think that we made, a lot of progress towards increasing access to coverage for so many.
That's awesome. Thank you for your volunteering with us all these years. You're really an important part of that event.
Thank you.
Why is it important, Ryan, that you talk openly about this?
Because I think about my own experience, and I suppose that that a lot of men go through this when them and their partner are experiencing infertility. I thought to myself, who can I talk to? Who can I talk to about what this feels like as the husband to a woman who is experiencing infertility? And I just, to be honest with you, I never found that. And so I thought there is a real opportunity for me to be that person to the, to the next person who's experiencing infertility. And quite honestly, I have at least one of these conversations every week with other men who are in a relationship where they have to pursue some sort of assistance or a collaborative arrangement. And so it was important for me to remember every single time that, I'm counseling a client that, a lot of times women are the ones who call me first, right? It just happens to be that way. And I always say, look, I'm going to need to talk to your husband at some point, because he's my client as well. But if he ever just wants to talk to me, one intended parent to another, remember that I've been through this as well. And so I'm happy to have that conversation if they'd want to. And so that's why it was really important for me to kind of constantly remind myself of the experience that I had, and that, having a conversation, you call these kitchen table conversations, I call them conversations over a beer. We should be having conversations over a beer about this as well, right? And so that's why I'm constantly having these conversations.
Awesome. Thank you. Erik, welcome. We'd love to hear a little bit more about you.
Sure. Well, my name is Erik. I do a podcast and blog with my wife. It's called the website is called livechildfree.com. And our podcast is Living Childfree with Erik and Melissa. And basically, we are two people who've gone through infertility, multiple rounds of IVF. I, in my past life, was a parent, and unfortunately, my daughter from that previous relationship passed away. And so we talk about all the trauma associated with our infertility journey, all the pain, all the disappointment. And we sort of strive to be a resource for the people who, what I like to call the 80%, because they told us that reproductive technology has basically a 20% success rate, but you never hear about the 80% of people who aren't successful. And I know those numbers are not exactly right, doctor. But just for the sake of the phrase, I just say we're the 80%, and we talk to people who have been unsuccessful with adoption or IVF or treatment, or couldn't afford those things. And so we advocate for them and try to help us realize that, life will go on and you can still have a great, meaningful life, even with the major disappointment that is not being able to have children. So yeah, that's our story.
Thank you. Thank you for being there for that part of the community. And I'm sure it's not always easy having to relive the trauma of your infertility journey, but I'm sure you're appreciated by many. So thank you for being here with us. We're really honored.
Oh, thank you.
Brandon, our second time kitchen table participants. Brandon Johnson, welcome back.
Thank you. And thank you for inviting me back, Rebecca. So I'm Brandon Johnson. I'm a mental health therapist / coach. And I help people through the emotional aspect of infertility and the infertility journey. The primary reason that I do it is because the journey is difficult and it can take you much longer to decide or how to get through the depression stages and the other stages that come with the loss of your fertility, and even unknowingly. And I just wanted to help someone shortcut that, because when I was going through my infertility journey, I was looking for someone, but I couldn't find anyone I could talk to. And unfortunately, this panel here and other guys just weren't easily accessible. And I did find Resolve, and that helped a little bit. And now working with them to advocate for men and helping to really spread that message that we go through this also, and that our journey is just as important. And that's why I do what I do, and really try to be the voice for the people who are unheard or don't want to come forward at this time. And the company is Infertility Isn't Inferior. You can find me on YouTube and Instagram at Brandon.therapist.
Thank you, Brandon.
Thank you.
Dr. Koo, last but not least.
Hi, guys. Thanks for having me here. I'm Lowell Koo, and I'm an infertility specialist. And my story is not too different from everybody else's, from my patients as well. So my story is that my wife and I, we got married and during training and OBGYN training, and we wanted to start a family. So we started trying, and trying turned into a chore, right? And it just didn't work for us. And we decided to go see an infertility specialist, and we started to try some medications. Then I graduated from OBGYN residency and luckily got into an REI fellowship and started my fellowship in infertility. And we continued to try. It didn't work. We tried IUIs, and finally we decided, okay, let's try IVF. So we did our first round of IVF, and unfortunately it was negative. And so I was a student fellow without any funding, and we scraped together what we could to try to get through one round, and with it being a negative, it was devastating. We tried again, another round of IVF, and we got pregnant, but we miscarried. That was awfully hard on my wife. And then we tried a third round of IVF, and it didn't work. And so, you know, at that point in time, we really struggled. We wanted to see what our future was going to hold, and we were fine with living a life that was child-free, and we were ready to embrace that. But we thought, okay, well, maybe we'll try one more time. So I started my job down here in Dallas, and we tried one round of IVF, and thank goodness we got pregnant with my son, and we did IVF again a fifth time, and have my daughter now. So you know, I tell my patients that this is a journey, and I'm here with you. I not only am a physician, but I'm also a patient. And from a husband standpoint of view, I understand the struggle that a guy can go through with infertility with their spouse. And I tell my patients that you're not alone, and I'm here to talk with you. And together we're a team. We're a family first, but then we're also a team. And together we'll travel together on this emotional roller coaster in this journey. And I'm going to do everything I can in my power to help you get pregnant. And I utilize my story as a never-ending fuel to help me work harder, work smarter for my patients so that we can achieve their dreams.
Thank you. Well, I hope that our viewers, men and women, see a little bit of themselves in all of you, because you all have really different, yet, you know, there's different stories, different outcomes, but I always say with infertility, there's a common thread that weaves us all together. And no matter how people find resolution, that, you know, there's a similar themes and trauma and disappointment and emotion. And I think I'm hoping that our viewers see a little bit of themselves in you. So thank you again for being so open. You know, we reached out through our social media channels. I will be honest and say you're mostly followed by women. But we asked them, do they feel that men are excluded from family building discussions? And virtually everyone said yes. And so I want to open this up to the group. Jump in if you want. I don't always have to call on everybody. But how do you feel? What do you feel about that statement that men are excluded from the family building discussion? Do you agree or disagree? And what can we do together as a community to change that if you agree that men are excluded?
I don't know if they're excluded per se. I would say that maybe we guys are forgotten, right? So I know that when the society thinks about the term infertility, the first thing they think about is maybe a woman who's struggling to conceive. They forget that there's another part to it, right? I was just telling a patient today, it takes two to tango, right? We've got to remember the husband's part, and we've got to make sure that he's included as well. So, so rather than exclude, maybe forgotten.
I agree. Our roles become limited And I don't know why, even when going through the journey, it's like, did your wife get checked? Or how do we do this? And what's the best procedure for your wife? And you're trying to figure out all of this new information as well. And now you've been pushed to the back burner and your emotions aren't even dealt with. So even when trying to find someone to talk to or a therapist or anything, it still focuses on female infertility or postpartum and the other aspects of mental health, but never male infertility directly. So I could say if there's more that can be done that can put us in a conversation.
Yeah, I think the conversation is changing, actually. I mean, it's a very small sample size just from my own personal and professional experience. But I would say in the last couple of years, I've seen more men reaching out to me, more men being part of that initial consultation, more men saying, hey, I have a friend who knows about your success. Would you talk to my friend? He wants to have a conversation. So in my small sample size, again, I've seen more and more men wanting to have the conversation because they see other men having it, and so I think that's a really positive influence. The more we have conversations like these, it opens the door.
Well, I was going to say that, like, it's been my experience that the conversation, the field is totally dominated by women, and I am perplexed by it. I've been perplexed since we first started. Like my wife and I, we get emails and messages all the time, and it's 98% women. And my wife and I've had these conversations like, why aren't men really interested in talking about it? And so I go back and forth between like, well, maybe it just doesn't bother men as much as it bothers women too. Well, maybe it bothers them, but they're afraid to talk about it. And like, you ask me on any given day, I can give you a different reason. I haven't been able to figure it out, but it's true. Men are just not that comfortable talking about it. And I don't know why.
Did you do anything, Erik, in your and Melissa's journey to not feel excluded or forgotten? Did you purposely take control on something? Yeah. Or did you were you in charge of something during the process and when you were in treatment?
No, it was a partnership, really. I mean, nothing's really 50-50, but it was a partnership. I was definitely an active partner and talking about what she was going through. And there were things I had to do. Like I had a surgery to help with our infertility journey. That was a complete disaster. That's a whole other story. But so I was very involved. And so like when we started our podcast, I just assumed we were going to hear from plenty of men. They just didn't show up. And so, I'm still going to do my part. I'm still going to talk. We're all of us on the panel. We're going to do our part. But, there's something going on. Mm-hmm. And I don't know what it is.
Let me ask you this then. When you started talking about it or you felt involved and did it feel different? Did anybody feel, more in control? Do you think it's that helps at all? Did you see a change in your relationship in a positive way with your partner or spouse when you actively took part in it? And I'll open it to anybody.
Yeah, I'd say I think my wife and I definitely grew closer, but I think to kind of think about why do guys maybe clam up in the beginning. I think I remember I felt like I didn't know what my role was. My only role was to try to impregnate my wife, and it wasn't working. I was like, what do I do now, right? And so I felt like I don't want her to, because she was upset, she's crying, and I wanted to comfort her, and I wanted to be the strong person to support her and be brave for her. And what I realized was that by being that sort of, or thinking that way, I wasn't communicating with her that I also was struggling and hurting on the inside too. And I think, when I opened up to her, I think it brought us closer. She realized that I think maybe she thought I wasn't into it or something like that. I was like, yeah, no, I'm struggling with this too emotionally as well. And so I think it brought us closer. And I remember I was both personally embarrassed that I couldn't, help get my wife pregnant. And then professionally, I was like, oh, the infertility doctor can't get his wife pregnant. What's going on? You know, this is embarrassing. So it was an added pressure. And I think that, and some of my patients ask me, they're like, the wives asked me, said, you know, with this low sperm count, you know, my husband is going to feel, you know, not as husbandly. And I thought, you know, no, there's no shame in that at all. There's nothing wrong with having a low sperm count or having an issue with sperm, because it's natural to have something like that. That you know, the good news is that we may be able to help you. We might have treatments. So I tell the guys, don't be afraid to speak and talk to your wife and communicate, because if you don't communicate, you'll bottle it up inside. And if you bottle it up inside, it just starts to stew inside of you, and it just doesn't help.
Yeah, I took on sorry, Brandon, go ahead. I was going to say, I took on a role that I didn't anticipate, I suppose, when we went through this. One thing that I'm constantly reminded of every time I think about our own infertility experience, I'm always constantly thinking about one particular moment, which is my wife calling me from work while I'm at work, and she just says 3 words every single time: it didn't work. And those 3 words, they haunt me. And so every time, Dr. Koo just said those words, and I thought, oh my gosh, here I am. I'm thrown right back into it. And so I felt like I needed to explain to people why it didn't work. All of our friends were having children. We were in our late 30s. We didn't have any children yet. And I felt like we needed to explain it, why we didn't have children. I don't know if that was, at the time, I didn't know if that was common. Did everybody feel like they have to explain this to people? And so I kind of took on that role as somebody who was, the most important support person. But my wife did not have, she struggled telling people. So my role was to kind of explain to people what we were going through, and that we were counting on modern medicine to help us. And so here's, I'm not going to get into all the details, friends, but this is what we're going through right now, and this is what we're trying. And so I kind of took on the role of kind of messenger for the family.
Spokesperson. Brandon, what were you going to say?
And I know during my journey, I was the one who went through the truly emotional distress, and it was from azoospermia. It was the pressure of trying to have a child, and constantly hearing from family, like, when are you going to have a child? When are you going to have a child? All that stuff about you going to college, career, and you being settled. All that is done now. So now this part you have no excuse for. And so when it came to my wife, I joined her fight late. She went to a couple of doctor's appointments without me. And it was just more, I thought I was embarrassed. I was embarrassed at being the man. And I didn't think I was man enough to even be a husband at that point. So I told her, like, hey, you can divorce me, go have children, build your family. I'll live as a nomad. And at the time, it was that emotional struggle that now I recognize that men go through, because of how our fertility is also tied to our ego, even though we don't pay attention to it. Because on a primal level, it's what we it's what we ought to do. And so in helping to support her and us supporting each other, I started going to the appointments with her. And once I seen how invasive those appointments are, I became more emotionally invested. Like, okay, I really have to step up and be a partner in this. And we have to go through this together and start talking about it and going through the emotional steps together, and realize that it's not all about me. So that's 2 answers. One is to why men show up late, and then how do I support my wife in this? And it's just really starting to understand the journey. And it's not all about the individual, but it's infertility is a couple's concern. And you have to work through it as a partnership.
So speaking to that, what do you wish had been there? Like, what was missing? as the male partner in the journey, what was missing for you all to feel supported? What did it start at the doctor's office? No offense, Dr. Hill. Did it start there? Did it start with just not seeing yourself represented in the conversations online?
I think it was, for me, it really was just information. And that could be from the literal medical information and the success rates, things like that, to information about maybe some of the emotional turmoil that may come from the infertility journey. And then also other people's experiences, good and bad. And so for me, that's really what we were just reaching out for, was just some information, because we felt completely alone. Mm-hmm. And like I said, it was like, there's got to be other people who've gone through this, but I can't seem to find them. So this is why I love things like what we're doing right now, is because there's somebody who's going to get something from every last one of us in this talk. And so I'm happy that we're doing this.
Good. Yes, we will help. We will help definitely one, but many, many people with this conversation.
Right.
Was there anything else, Brandon, that was missing?
To piggyback off of Erik, it was information. And I finally want to open up in life and talk to people. I do it for a career, but I'm bad at really opening up and talking about it until now, where I talk about it all the time. So it was information, and then having someone who actually understood versus just relax and it'll happen, or you're a good person, it'll happen. And infertility doesn't choose people who are good or bad. It just happens.
Yeah.
How did everyone's family, or your external family, not just your partner or your wife, how did your external family play a role? And did you open up to your external family about this? I see Dr. Koo, you're shaking your head. I'll start with you.
We were originally very, very private. My wife's a very private person, and she didn't want to share this issue with anybody, and she just felt like this was our own private issue. And so I didn't say anything to anybody. So of course we struggled these years without telling anybody. Nobody understood why we weren't conceiving or starting a family, and they would always ask. And I think one of the toughest parts is the pressure from parents. My parents they were very, very, love them. They're great, but they just would not stop. They would call me up and say, guess what I'm doing? I'm like, what, Mom? I'm holding a baby. I'm like, that's great, Mom. When am I going to get a baby? Like, I know, Mom, we're working on it. You're like, what's taking so long? I'm like, don't worry, Mom, we're working on it. So, and meanwhile, 3 years had passed and we are struggling. Christine, my wife, is crying, and we've gone through countless numbers of doctor's appointments, shots, retrievals, and we didn't share it with my parents. So I tell my patients, it's, do what you feel is best for you, but don't keep it inside. Find your support group, find a network of people who you trust, talk to them, because that's what I kind of wanted. I wanted just another group of guys where I can say, like, what did you guys do? How did you feel? How did you handle this? And back then, my kids are 12 and 10 now. Back then, almost 13, 14, 15 years, we didn't really have any sort of support group like that. So it was, we had to kind of travel alone and travel in silence almost. It was really tough. So I tell patients, don't travel in silence. We're here. We're a family. We can talk.
Yeah, we, Lindsay and I, we had, we made a decision very early on that we were going to tell as many people as we could, because you never know who you're going to talk to who's going to say, you know what, I've been through that, or my friend has been through that, or my sister has been through that, or my brother's been through that. And that is how a lot of people end up talking to me, in casual conversation about our experience, because they're hearing it secondhand or third hand from somebody who says, you should talk to Ryan. He's been through it himself. And so at the time that was our thinking, was we're going to tell as many people as we possibly can, tell them to spread the word. Maybe somebody can point us in the right direction. Sharing as much information as possible. If it furthers the mission of having a family, we were going to do it. Our families were very supportive. They all understood. My father-in-law is a pediatrician, so he was also was able to kind of weigh in on some of the medical guidance. But I meet people all the time who have concerns about sharing this with their families because of what Dr. Koo just mentioned. There's a certain expectation, right? And a lot of times you don't want to disappoint people. And so sharing it with family was sometimes difficult. There are social or faith-based concerns as well, but that's a whole nother conversation. And so sharing it with as many people as we possibly could was the way we saw as the only way to find the answers that we were looking for.
It's funny that you say that. I remember early in our journey, my husband and I went through it as well. And we would go back to his college and university for football games. And we always knew when someone was going to come and ask us questions, because they would come up and they'd be nervous and they would say, we've heard you, insert whatever it is, went through IVF or having problems getting pregnant. Can you help us? And my husband was always, he's talked to a lot of his friends over the years. And it was really an honor to see some of them and their wives at Advocacy Day last week. I was on a call with them. So it was, that's what we do, right? We're creating community around this important cause, and we can only do that by speaking out. And so the more male voices we have, the more we can help. So I think you're all walking the talk, as they say. So let's talk about that. Let's kind of talk about the conversation. What should the conversation around men and infertility, not male infertility, but men and infertility be? What should the messages be? And what do you think they're lacking in now?
I'll just follow up on what I was saying earlier, which was providing as much information as possible to as many people who are willing to listen. If people have questions about infertility, you might be their primary resource as to understanding what infertility means, even though you're just a friend. It doesn't have to be a professional. And so we wanted to spell out for our friends and our family what infertility meant to us, spelling out in vitro fertilization. What does that mean? There's a lot of, sometimes you need to dispel some of the myths about it. And so we wanted to be very, very specific about our experience, and, because it could help just one other person. And everybody's cases are unique, obviously, but you certainly are going to find somebody who is similarly situated to you, and they are going to be able to rely on using that specific information that you're providing. Now, that doesn't necessarily help someone who's going through it, but they may be able to share their experience, and you never know who has been through it themselves.
Well, for me, I think the biggest thing is just sort of providing a space for all of the different experiences. There's experiences with infertility, miscarriages, being child-free, and everybody's always seems to, the general question everybody wants to know is, am I normal? And the answer is yes. We all on this panel have had different experiences, and we all ended up in different places. And I just think providing a space where men and women, everyone, can sort of see themselves reflected in some sort of way, and then maybe have a resource or two they could go to that, there's sort of along the path that they find themselves going towards. So I just think that as long as because that's the struggle we all had. We kind of didn't know where we were, what to do. We didn't have resources. And so as we're talking now, we're sort of showing a couple of different paths for everybody. And I just think that providing space for that would be a big help. Because I think that's how men are. We don't necessarily want to talk all the time. We just sort of want to know, what do I need to do? Where's a book? Where's a YouTube video that I can go watch to learn about this? Whereas, now I know I'm generalizing, but it seems like women are more comfortable sort of talking and commiserating together. Whereas men, when it comes to solving problems, that's not our go-to. Let me go to a group of men and talk about it. It's like, where is there a book? Is there a resource? Is there something I could go to help me with that?
Erik, I don't want this conversation to end without making one comment about what you just said and what you've said from the very beginning about living child free. The very first time I ever heard that phrase, living child free, was at Resolve's Federal Advocacy Day 4 years ago. The woman who was the chair of Advocacy Day, she decided to live child free. And she used that phrase, and I had never heard that before, even though I had people in my life who had decided to live child free, right? But I'd never heard that phrase. And I thought to myself at that time, my gosh, you are going to help so many people by talking about this. And so she's a woman, obviously, and now here comes Erik Jones, and he's using that same phrase. I'm thinking about her, and I'm looking at you. I'm thinking, I can't imagine how many people you're going to help by talking about living child free. You really are going to make an enormous impact. Because I'm just thinking one generation ahead of us, so many live child free. And they didn't have the resources that are available now. They certainly didn't have men having these conversations, right?
Right.
And so I applaud you for doing what you're doing. I didn't want to miss that opportunity.
I appreciate that. Thank you.
I agree with Erik also. It's also creating a space that is safe, judgment free, just to say, hey, look, we're family. It's okay to kind of break through that shell of machismo or trying to be strong when it's tough to. It's okay. It's okay. Yeah, we've all been there. We're here to help each other. No judgment. This is a safe area to talk.
Yeah, and allow yourselves to be vulnerable and talk it out, or physically get it out. Find a way to release the pain and burden of infertility and the stress that you're going through, and that's regardless of the partner. And be there as a partner for your spouse, because you both are experiencing some emotion. It's just a matter of where you both are at the time.
I will say, when my husband and I went through everything, what helped us is having, and he actually started this. We had fertility-free Fridays where we didn't talk about it at all. The subject was off limits. It was every Friday. And then he also was the one that pushed us to go to a mental health therapist. And so, if it weren't for him, and we found one that specialized in infertility, and that was incredibly helpful. So do not be afraid, gentlemen, to bring that to the table. It also made me realize he was in this, even though I'm the one with the appointments and the injections and the medication. And I think that's why women feel the burden of all this, because no matter what factor it is, it's always going to be the female partner going through the brunt of the medical. I know there are medical procedures associated with male factor, but through the IUI and the IVF. And so we take that on ourselves and we hold it, and we maybe to you all doesn't look like we need to let you in, and we do. And so keep knocking on our door and making sure that we hear you, because I think too we need to hear you and listen. And that would be my advice for any of the women watching, that ask your husband how they're doing, because you might be surprised to hear that they're not doing well. And that's when it's a partnership, as some of you have said today.
Yeah.
All right, as we wrap up, I'm going to ask each of you, I'll give you a second as I talk through this, to your choice. Either reflect back and think about when you started this journey to where you are today. What's the one piece of advice you wish someone had given you? Or now that you are where you are in life, what's the one thing you learned that you want to give to someone else? So either or both, and then we'll wrap this amazing conversation up. Who would like to start?
I'd be happy to start. Just say, I think that one thing that I'd like to impart, and I tell my patients this, number one is, and I think we've mentioned it here before, is that it's not your fault. Number one, it's not your fault. You didn't do anything to cause this. It's not your fault. Number two is communicate. communicate with your family, communicate with your spouse, just have a network of support. Those are the two main things I'd like to impart upon to the audience today.
Thank you.
The first thing I want to say is, man, don't be afraid to reach out. You're dealing with this journey as well, and you're going to have your emotional struggles, and talk about it. And that's what I love to provide people, is a space to talk about it. And then we could dive into other reasons and other ways of why they're affected so much. The other piece of advice I have is straighten up your crown and stand tall as the kings that we are. Because yes, this journey is hard. Yes, we're affected, but it doesn't make us any less of a man. And I wish someone would have told me that sooner.
I'm just going to, I'm going to say that unless you're Dr. Koo or one of his colleagues, we don't have the answers, right? We don't come to the table saying, oh, this is what we're supposed, there's no playbook for infertility, right? Every single person comes to the conversation with no answers, right? And so do not be afraid to ask a question, no matter how silly you may think it is, no matter how much you think it may be unrelated to your particular situation. I had a million questions and a million questions I didn't ask, right? Maybe because I was afraid to ask them, or I just thought that I was supposed to know that. I don't know, but don't be afraid to ask the questions. As for advice that I would give to somebody who is similarly situated to me, a husband in a partnership that was experiencing infertility, constantly use we and our. I caught myself sometimes saying, making a distinction between me and my wife when it was both of us that were experiencing infertility at the same time. And so use we and our, constantly remind yourself when you're having those conversations to tell people that we are going through this together.
Well, I think actually the thing that I learned and the advice I'd give are the same. And that's that, this is particularly for men, is that you're not alone. I wish someone had told me that when I first got into the infertility space. And now that I've been in it for a while and I've talked to lots and lots of people email us all the time, and I know that we're not alone. Like, I get emails all the time that said, we went through what you went through. Thank you for talking about it. And specifically for men, you should know that you're not alone. Even though you may not see lots of men talking about it openly, there are people out there who are going through what you are going through, and you're not alone. That would be my advice.
Well, that's an excellent way to end this conversation. We are so thankful that you were all able to join us today. We've said it a few times, you're going to help. You're definitely going to help somebody. And I'm excited to see the reaction to this conversation. It's one unlike we've had before. And we have some more interesting ones coming up. We have one we talked about a little bit about before, one on the intersection of infertility and religion. So we want to bring more conversations. So if you have a topic you want to see us cover, Brandon, we can make it three, your third time's a charm. We'd love to have any of you back at any time to talk about these important issues. This was a really thoughtful conversation. I think we covered a lot of ground in a short amount of time. I told the team today at Resolve that I got to spend the afternoon talking to a bunch of guys, and that really, really is not something I get to do every day. So thank you. So for those that are new to Resolve, we invite you to check out our website, resolve.org. You can find us on Facebook, Instagram, and Twitter. If content like this is helpful, you can support our mission and donate to Resolve through our website. We count on contributions from people in our community, which help us provide free support programs and helps our advocacy work throughout the year. So again, Erik, Brandon, Ryan, and Lowell, thank you so much for joining us, and take care.
Everyone.
Thanks, guys.
Thank you.
Thank you, everyone.